Whether it's an individual in crisis, a loved one, or a friend, mental and substance use issues can impact us all. No one is immune. Emergency room wait times are unpredictable, stressful, and often the care is not effective at addressing the crisis.
What used to happen is they would call the police, 911. Automatically, the police are going to bring that individual to an ER. They don't have to do that now. We have mobile crisis teams that will go out to where they are, and we can evaluate and hopefully determine next steps there. Just by merely having someone be available to them and talk through their challenge at that moment is extremely helpful. The sooner we can intervene and stabilize the situation, the better outcome we have in keeping that person out of the ER. The idea is to call early and call often. You want an intervention quickly, that's why our teams are ready to go. Our job is to go out, evaluate them, to determine if they're safe. If they're not safe, do they need a higher level of care, which means them going to a hospital, or can we put a plan in place where the person feels comfortable?
Now there is a powerful alternative to calling 911. The New Hampshire Rapid Response Access Point Hotline provides help via telephone support. When in-person help is necessary, a mobile crisis team responds anywhere in the state, providing quick, effective, and compassionate care. The person in crisis will recover with the aid of community resources that are more accessible and cost-effective than a visit to the ER or being placed in an inpatient psychiatric bed. The sooner people call, the sooner help is on the way, and the more effective the support is likely to be.
In order for someone to receive help if they're in crisis, they call the Rapid Response Access Point. It's a centralized call number. At that point, they're screening the call, they're determining the level of need. At the point that they feel that the crisis cannot be resolved over the phone, we have a platform that we work from where we actually get a ding from the access point. It'll give us the information we need to go out into dispatch, and we're going to wherever that person is. We see them in a comfortable setting, so they're more apt to share information that they may not share in an ER. What we're asking these people that we see to do is to open up to us, and it's very difficult to do that in a sterile environment like an ER. We need a good space where the person feels comfortable and is willing to really share some deep thoughts and dark thoughts that they're having.
Founded in 1977, West Central Behavioral Health provides a wide range of services to those experiencing mental health and substance use disorder-related issues, bringing treatment to vulnerable individuals and reducing the stigma associated with these conditions. New Hampshire created its Rapid Response Access Point Hotline and Mobile Crisis Response in-person services to provide expert clinical support to help people in their time of need. Now, no matter when a mental health or substance use crisis hits, appropriate care can be administered in a timely manner through services like those offered by West Central Behavioral Health.
Mobile crisis intervention in real time, not waiting for an individual that has to schedule an appointment. Going to them is really transformative, and I think that West Central staff have already seen the impact of how people can get what they need at their time of need and don't have to go to emergency rooms. We've actually seen really strong data that is supporting the fact that people are avoiding hospitalizations at a much higher rate. And that has a huge impact both for us as the clinical team, but as well as just changing the community and their experience. A mobile crisis response system is predicated on people calling and initially getting a triage. And if the phone intervention is not sufficient, then a team gets deployed and works with the people that are involved. We do the same things with schools. If we ever get called out to a school, we're intervening not just with the student, we're intervening with the school staff so that they can be more effective in the future.
Mobile crisis services are here when you need them, no matter the place or time of day. There is no shame, just listening ears and caring staff, ready to meet you wherever you are.
Whether that's school, the parking lot, their office, home, wherever. We try to provide those follow-up sources so that if they need to come see us in the office for once a week for the next few little bits, then we can help them out until they have some way to navigate what's going on. So a lot of times the behavioral health issues can be managed by us going there and having a conversation with people to see how we can help. A crisis is very different for everyone. The important thing is no matter how big or small you think what you're going through is, there's a number that you can reach out to call and try to get some help.
In the past, when we had a student having a mental health crisis, getting a student to actually receive the evaluation that they need in the time that they need it was a very difficult thing. With this new response in place, we're able to have the student receive help when they're having the crisis. Instead of waiting days, sometimes up to a week to be able to receive help, we're able to get that help immediately for them so that they can start that healing process. These students are better students overall, they're missing less school, they're more attentive, their grades have gone up, and they're getting what they need to be able to come to school and focus and do their best.
We all experience crises. And the idea is to get out there and be proactive as opposed to reactive, and make sure that the individual is safe.
The mobile crisis model really fits well in bridging the gap between traditional routine office-based services and hospital-based services, including emergency room visits or inpatient care. It's there 24/7. Calling us is not a burden. We're here for this very purpose.
There is compassionate, timely support available through the NH Rapid Response Access Point hotline via phone, online chat, and in-person outreach. Help is only a phone call away. Learn more today about West Central Behavioral Health, nurturing dreams, transforming lives. If you need immediate help, call or text the new 24/7 New Hampshire Rapid Response Access Point hotline at 833-710-6477 or go to wcbh.org. For more information on West Central Behavioral Health, call 603-448-0126. We extend our generous thanks to the New Hampshire Charitable Foundation for helping to fund this video. NHCF was founded in 1962 by and for the people of New Hampshire.